Friends, I am Dr. Sanjay Pandey from the Department of Urology at the Kokilaben Dhirubhai Ambani Hospital in Mumbai. It's important for us to be aware and aware again and again that changes happen in men from 40s, 50s onwards to 60s, 70s, 80s, and 90s. The progression of change in hormones brings about two important changes in the region of the prostate, a male organ, which controls the urinary flow through which the urethra actually empties. So, friends, prostate, a male gland, which undergoes a change from 40s, 50s onwards, could be two different changes. One change which I continue to deal in the last 25 years is the progression of obstruction to the flow of urine for men. And men many a times don't pick it up. They many a times miss out that the obstruction, a progressive change, is not looked upon because they never compare with themselves in a public toilet. They never compare with others in the public toilet. And they miss out that the flow is gradually going down. The stream is getting narrow. You have to push and pass urine. You don't empty your bladder completely. You get up multiple times at night. And many a times you've got frequency, urgency, and urge incontinence, or sometimes even leakage of urine. The bottom line is the prostate, a male organ, is undergoing a progressive change. And this change is important for us to know because all men will go through it. Some minor, some moderate, some severe, some very early in life, and some very elderly would be picked up only because it was a delayed pickup. So, friends, it is important for us to have a prostate health checkup. Important for us to be aware that prostate health changing progressively day by day, year by year, and decade by decade can be picked up by your urologist in your cities and your towns. What does it mean? In a man between 40s to 80s who complains of the flow not being good, who takes time to start, takes time to empty, and takes a long time to empty and sometimes doesn't empty his bladder, could have been placed on medical treatment by physician colleagues and by anybody else, but we need to assess him. The assessment is most important. In other words, when we want to know the heart, we do an ECG and know all about the heart, and we go up the ladder in terms of evaluation. Similarly, if as a urologist at the Kokilaben Dhirubhai Ambani Hospital, I need to know how is your prostate health. All that I would ask you is an International Prostate Symptom Score or IPSS symptom score to be downloaded and assess yourself as to what is your score, mild, moderate, or severe. When you come and see me at the Kokilaben Hospital, I would say, is your flow very good? Do you empty your bladder well? Do you get up multiple times a night? And you get to know a lot of answers, which is actually all there, but we never were asked. We ask you to do a test called uroflowmetry. Uroflowmetry is ECG of the bladder. In other words, the graph that comes out when you pass urine in full bladder in a computerized toilet tells me all about what is happening with you. A very, very important test. So, friends, the ECG of the bladder, called the uroflowmetry for a urologist, gives all about your performance status of the lower urinary tract, which you are empowered to empty when the kidney produces urine non-stop 24/7 and is delivered into the urinary bladder. Friends, this uroflowmetry is undergoing a progressive change from a wonderful bell-shaped curve in the era when in our younger days we could pass urine onto the wall. That era is gradually gone and progressively is replaced by changes happening. What are the changes? The flow could be a difficult start, it could be a baseline start, it could be a staccato straining pattern or a plateau pattern. All these patterns gives a urologist an idea about what does the ECG of the bladder look like. That means the understanding between the bladder's contraction and the passage opening is progressively changing because hormone related changes in the prostate many a times for a common man in the street, and many times my physician colleagues talk about the prostate size is small or big. I don't think that's important. Important is not the size of the prostate alone. Important is what does the prostate do to the urinary passage, which is gradually occludes over months, years, and even decades, which you can't pick up. It's not easy to pick it up. As a male, as a man, we pick it up only when it's too late. When we know that the flow has reduced below the critical level, when you take time to start and empty and don't empty completely, or go multiple times to pass because the bladder is now contracting erratically, in a progression of change that is happening in the lower urinary tract. So, friends, prostate changes are assessed by number one, an IPSS symptom score, which you could download as IPSS from the internet. Score yourself, go and see your urologist. He would necessarily ask you questions, be a friend to you, understand who you are, and then would look at a uroflowmetry when you pass urine in a computerized toilet to look at your report card as to how good the report card is of the performance that you do umpteen times a day, which is progressively changing, as I said. You're carrying an ultrasound report which only tells the size of the prostate, the bladder wall thickness, because the bladder is overworking. Many a times you could be having a high residual urine, some debris in the bladder, and many men land up also with urinary infection. And what does infection mean to men? Infection about burning, discomfort, pain, sometimes bleeding and fever does not normally happen to men. If it happens, it could either be an occlusive phimosis or the skin being too tight, more so in diabetics where the skin does not go back and you can't maintain a hygiene of your penis compared to a circumcised man. It could be a stricture urethra or a blockage in the urinary passage where the urinary passage is tightened up and therefore it needs a urethroplasty or a urethrotomy. The prostate could be occlusive and blocking the urinary passage and the urine does not come out freely and you are infected. Or finally, there's a possibility that there could be a man with neurogenic bladders, bladder's powers are lesser and then does not empty. So friends, urinary tract infection in men is not common. If it is happening, these are the 4 causes I enlisted. So as men, we want to do better with every passing day, month, year or decade. And we know that like women have got menopause or hormone changes, men also undergo it. And when they go through it, many a times it's missed out. So why not wake up? Why not wake up as men across the country and the world about changes happening in our urinary passage that we may have to go through what our fathers and grandfathers need to go in terms of the flow being bad, operations happening, bleeding happening, catheters going in. We need to prevent that. And therefore is the health checkup in a prostate health. So at the Kokilaben Hospital in the Department of Urology, it is important to empower all men who come in their 40s to 80s, understanding them, realizing the changes, hand-holding the journey about getting them improved in terms of attempting to shrink the prostate, improving the urinary flow, bringing about a control or incontinence. So this is something which I continue to do morning till midnight, helping individuals out who come as needy. There's a silent change which happens because of hormones on the other direction, which is called as prostate cancer. And this does not come with any noise and sound, except a surrogate marker called PSA can even be normal or can be abnormally raised in a normal individual. So PSA or prostate specific antigen, which is normally less than 4 nanogram percent, could be much higher. And this higher range without you having much complaints could almost push you to a urologist who would examine you, do a rectal examination, assess you if required, do an MRI of the prostate, called a multiplanar MRI to assess the prostate entire configuration and looking at the Pirad score. If need be, a very hard prostate or a Pirad 4 and 5 undergoes a biopsy. We assess the biopsy and undergo to change that whether it's a prostate cancer or non-prostate cancer. Prostate cancers are then looked at stratification of the staging by a PET scan called PSMA PET scan. And that's what I continue to do in terms of curing by a radical robotic prostatectomy. That means with the Da Vinci robot at the Kokilaben Dhirubhai Ambani Hospital, few times a month, few times a week, we take individuals from late 40s to early 70s and beyond 70s to before 80s, where we bring about a curative activity by removing the prostate. So the prostate is removed and we join the bladder to the urethra, bringing about a control mechanism which helps them to get a control, to be able to empty the bladder, and the disease which was localized within the prostate has been completely removed as prostate cancer. Follow-up in prostate therapy is almost a must. And therefore, either you are on medical management, you should be continue to improve. If you're not improving, then you're missing it out. Friends, today is also the era of minimally invasive surgical treatment of the kind which I continue to do at the Kokilaben Hospital called the Urolift therapy. Urolift, in other words, implanting those staples which actually keeps the prostate away from the urethra and urethral occlusion is treated, is a way of life over the last 14-15 years, approved by the US FDA and over the last few years in India. And to us, patients who are very young, who have got occlusion or obstruction, are worried about a TURP and a HOLEP, actually can save their ejaculation and erectile function by just undergoing a Urolift or a minimally invasive surgical treatment. Men who are not responding very well to medical management and taking medicines after medicines, month after month, year after year, need to be reassessed as to why their therapy is not helping their prostate health and prostatic urethral occlusion in terms of a good flow. And these individuals also are assessed and taken forward to the next possible level. And finally, when you move forward from here and look at those elderly people who are morbid, who have got various contraindications where the cardiac and neurological contraindications don't allow them to be actually taken to the operation theatre. Urolift helps them to undergo a prostate therapy in terms of occluding the removal. The catheter comes out and they are free from the catheters in urinary infections and many a times medicines too in the evening of life when surgery is not possible. So friends, Urolift has stood test of time. Or the public awareness that I continue to do on the YouTube channel, out of passion to making more people aware. The prostate as a health is a passion that I need to pursue and to reach all men, to be able to take their prostate health scores, to be able to see their urologists in the cities very often. at the Kokilaben Dhirubhai Ambani Hospital in Mumbai in the Hairy West, in the Department of Urology, I continue to usher in this important aspect of empowering a lot of men who may not be knowing themselves. So health checkup gives you an idea about what does health checkup overall mean. Prostate could be an enlarged size, could be normal size, but the questionnaire across this table where I'm sitting in my outpatient department on the second floor helps us decipher the change which has already happened and the change which is going to progress in due course of time. Friends, prostate health needs to be taken care of. It undergoes change in any of the two directions I've talked about, a benign occlusion or obstruction which bothers you, or a change which is silent and progressive and ominous called the prostate cancer, and both of them are completely treatable and curable. It's time for us to take it to the next possible level, and therefore it behoves that let's be educated on this prostate health. Let's know more about it. Let's not live on myths. Let's not postpone health to the next row and probably take it to the front row seat as all men who've got urinary complaints or all men who have got any issues with the prostate. It is important for us not to miss it out and come tomorrow, which could be probably a more difficult phenomena compared to what it is today. Friends, signing off from Kokilaben Dhirubhai Ambani Hospital's Department of Urology on the second floor. You all are welcome to consult, take it forward on a journey of treating prostate health to the next possible level. Thank you very much.